Good evening. Thank you all of you who are joining us on our Facebook Live this evening to answer your questions. And I'm really happy to have with me this evening Sarah Massey, our partner from the Department of Health. Sarah has been with the Department of Health for a number of years, and she's recently been collaborating with the Healthy Return to Learning team. And Sarah is the school health specialist at the North Dakota Department of Health. Welcome, Sarah.
Thank you.
Would you tell us a little bit about yourself, give us a little bit of background so people know who they're visiting with this evening and get to know you a little bit better?
Absolutely. Good evening, everyone. As Superintendent Baesler said, my name is Sarah Massey. I have been at the Department of Health for 4 years now. Previous to that, my trade is education, so I taught for 12 years in a K-8 school. I was in many different sectors of the education world, going all the way from physical activity or physical education and health teacher to ELL teaching, and then I also finished my career at the school as the 7th grade teacher. And we were in a self-contained classroom, so I taught all curriculum, so I understand the education world pretty well. And so when I came up to the state 4 years ago, it was a big eye-opener for me because I wasn't really familiar with public health, but very familiar with education. And so I've been working the last 4 years in creating healthy environments for schools across North Dakota. And so that's just a little bit about me. I'm from Bismarck, born and raised. My family are all educators. And so this whole public health world is a little bit challenging, but it's also has been a really interesting, and I've learned so much. And just being a part of the Healthy Return to Learning team the last 2 weeks has really opened my eyes to a lot of things as well. So thank you, Superintendent Baesler, for having me, and I look forward to answering you guys' questions.
Very good. Thank you. So I think our audience can probably see why we feel so fortunate and blessed to have Sarah as part of our team helping us through this unprecedented year of starting school with our dual mission of high quality education for every student while keeping our students, their teachers, and their families that they go home to safe every day. So the first question, let's start up pretty fundamental, but I think it's a question that you get asked often, and I think it's important for us to keep sharing the answer to this. So what is the difference between quarantine and isolation? Two words that we hear often and we don't really know that we have a command of yet.
Yeah, absolutely. So it's understandable that people are interchanging these words. And so it's really important when you think about quarantining, you're thinking about contacts. So quarantine equals 14 days, and those are like contacts, close contacts. And when we say close contacts, we mean the last date of exposure to a positive case. The next day starts your 14 days. And then as long as you don't come into any interaction with another positive case, which you should not because you would be quarantining. We also have another, it's called household contacts. Household contacts have a minimum of 24 days in quarantine. And I'll explain that a little bit more when we talk about isolation. So isolation is when a positive case is identified, we isolate them for 10 days. And so through that 10 days, the Department of Health monitors them, they monitor their symptoms, and they communicate with them on a daily basis. And so at the end of the 10 days, we go through their surveys, they take daily surveys, and we ask them about any symptoms, if the symptoms have progressed, if they've gotten better, and if we see symptom resolution along with 24 hours fever-free without medication, we release them out of isolation. Here's what can happen. If the case is not getting better and it extends out to, let's just say 12 days, then the household contact does not get to start their quarantining until we release the positive case out of isolation. So at the very best scenario is if we have a case and they're isolated for 10 days. Your household quarantines that 10 days. When we release them after the 10 days, your 14 days as a household contact begins. So that's why we say a minimum of 24 days, but it can last longer depending on if we have to keep the positive case under isolation for a longer period of time. So quarantining contacts and isolation is positive cases.
Wonderful. Thank you for that very important and thorough explanation. I learned a lot even. Thank you. So what happens if I test positive and I refuse to go into isolation or quarantine?
Well, what we do basically, and we have run into some of these cases, of course. And so what we've done is we obviously contact you that you're a positive case. We take down a full, thorough case investigation. It can take up to, it can go from 45 minutes to 2 hours, depending on the number of contacts that you have. And then we really gather a lot of information, where you've been, all those types of things. And we really go through and provide you facts about what can happen if you break isolation. And we send fact sheets and all those kinds of things. What can happen is that at a local level, if the local police departments are wanting to enforce, they can enforce. We've let, the governors spoke about this, that we're leaving it up to local PDs to take action upon this. And so we also see a lot of people that will call the local police department and say, we know this person should be in isolation or in quarantine. And they have gone to those people's home and addressed them and just educated them further. And so we just want everybody to know the importance of, when you are under isolation, you are isolating yourself and making sure that you're not transmitting to anybody else in our community. And it's important that we realize this, because in order to slow the spread, community spread, we all have to do our part. And if you are a positive case, we are just asking, we're pleading you to please isolate yourself, because if you don't, then our children can't go into our schools, our businesses can't stay open, because community spread is just going to increase. So it's really important when the Department of Health gives you directions to really abide by them. And really we're asking, like the Governor Burgum has said numerous times, personal responsibility. And so we really ask for the honor system and hope we don't have to get any law enforcement involved.
Thanks, Sarah. And I think that's a point that is, I think, worth spending a little bit more time on from the educational perspective. I know that there are families out there that are really struggling to find childcare to maintain their employment when schools are in an AB day or an AABB day. And so that is causing some significant challenges. And there are many people that aren't happy with our school board leaders making those decisions, and our school administrators, with the public health administrators making those recommendations to their school boards. And so I know that that's occurring. We hear everywhere that everybody knows how important it is for our students to be in school 5 days a week, 8:30 to 3:30. But we can't have that. It won't ever happen. That reality will never exist if we have continuing to have the rising cases of confirmed cases and the community transmission. That just will never be a reality for our young people if we have people that are confirmed cases and not abiding by the isolation, so they don't continue to spread it to other people. So thank you for that answer. Is testing going to be required for all staff and students before they return to school?
That's a really good question. So CDC is not recommending that we do mass testings with schools. Again, we go back to local control, and if a school district does choose to test their staff and students before they come in to the school building, that is completely up to them. But as far as the CDC goes, and we follow at the Department of Health the CDC recommendations, we are not going to do mass testing. We have to understand that these tests that are being done, they're called same-day tests. So let's just give an example. So if I go get tested and I'm not starting school until the 31st in Bismarck Public Schools, I get tested, let's just say 2 days before school starts, and I test negative, that means that day I test negative. But that doesn't mean in 4 days, if I tested again, that I would be positive, because it's a same day test. So that's why CDC is really kind of holding back with mass testing in schools, is because of that factor. It's not really giving us the best indicator of who really is a positive case. And then also a lot of our children are asymptomatic, of course, so they're not showing those signs of those symptoms. And we just have to remember that we can still test positive. You know, like I said, 2 days before we can test negative, 2 days after we can test positive. So it's just not best practice that we're doing that. But again, I want to just open it up. It's local control. And if you can coordinate with your local public health units to do so, and they agree to do that, that's completely at the local level.
And you know, I know some school districts are asking their staff to get tested and before professional development begins or before school starts. There are, on the North Dakota Department of Health website, there are testing events that are occurring all across the state. And so if a school district is wanting to have that as part of their back to school plan, and their community prefers that their teachers and maybe even their students be tested, those testing sites and those testing events are available to K-12 staff and students, correct?
Yes, thanks for mentioning that. So on our website, when you go to the Department of Health website, you can go under testing, and it actually has a link and it will pull up. They're called static test events, and we have them strategically placed all over the state so it's easy accessibility to everybody. And so you can pull that up and it will tell you the date, the times, all of that, and they're on regular basis. So I'm just using, I don't know for sure, but Bismarck Burley Public Health, every Tuesday from 10:30 to 12. Don't quote me on that because I don't have it in front of me, but I'm just giving an example of they're going to be the same days, same times generally. And if they're not, they put out a public notice that it has changed. And so we are encouraging, if parents want to have their students tested before, that they take advantage of those static tests along with staff.
Very good. Thank you. So how long does it take to get results of the static testing event results?
We're working really hard at the Department of Health to improve this. And we know that there has been some hurdles that we have had to overcome. But the last that I heard in a disease control meeting is that somebody found out within 24 hours. And so the state lab is really stepping up and producing those results. And then we've hired also other consultants that are calling out negatives and positive cases. And so we're looking at about, I mean, if you want to take an average, about 72 hours is the longest. And I know that there have been people out there that have waited longer than 72 hours. I want to note too that, you know, healthcare providers, if you go to them and they don't test in our state lab, they can have a lag time longer than the 72 hours. What we have established with the Department of Health is if you do go to a static event that is held by the Department of Health, and those static events are that they go to the state lab, and if you have not gotten your results, you can go into the testing area where I was talking about, and you can enter in the information, your name, the static event that you went to, and then you also have to upload a photo ID. And then that gets kicked back to our JIC, and then our JIC, then it's a whole process, and we try to kick out those automated negative results. If you are a positive, you will be getting a phone call from the Department of Health letting you know that you're positive. And I also encourage people to look at their, you know, I'm just going to use Sanford as an example, my Sanford chart. Sometimes that comes in before we even get it into our systems at the Department of Health. So important that you guys check those charts out as well.
So you mentioned how hard the Department of Health was working, and all the team and the lab particularly is who you mentioned. So I know you shared with me on Saturday the astounding amount of overtime that you are working. And I just think it's important for our audience this evening to maybe hear those numbers, because we know you're working hard. Everyone is running at Mach speed and have been since the first March. So, but on average, how many hours of overtime is spent by the average Department of Health employee?
Yeah, we're average. I mean, the lab is running pretty much 24/7. And so their staff, you know, are continuously working overtime. And I couldn't even give you an average of what they are doing, but we have our contact investigators, our case managers, and then those that are holding teams that are taking care of our correctional facilities, our group homes, homeless shelters, all those things. And I would say on average, a person is probably working between 30 to 50 hours a week over time that we would normally spend doing our regular jobs. And I'd also like to just note too that at the health department, it's all hands on deck. And so a lot of our programs, COVID was not my program before COVID happened. And so a lot of our programs have slowed down or actually had to halt because it's all hands on deck. We are doing the best that we can with the capacity that we have. But yes, we are all working tirelessly to get the test results out, to make sure everybody, is getting all the correct information, because we know that there's a lot of false information out there. So our disease control and our communications office are just doing an outstanding job of updating all of the resources that we have and keeping them up to date with CDC's recommendations. And so I would just say around the clock, we have staff working.
That is an astounding. I mean, to think about minimum of 30 hours of overtime every week since March. That's unbelievable. So thank you for that to all of you.
Yes.
So we had a question. JIC. What is JIC?
Oh, it's a Joint Information Center. And so it's kind of where all the information is kind of held. And so they kick out a lot of data. They analyze different things. And so it's just where all the information kind of goes to. And then they can, send it to whoever needs to get that information. So like testing information, we have a staff up here that they would kick out like negative results to or positive results to. And so it just comes out of that joint effort.
Perfect. Thank you. So this is kind of a lead into that next question about positive results, negative results. And this may be a question that may be better suited to maybe infectious disease or maybe even the state lab. But as with any test, there are some false negatives and false positives. And so in general, I don't know how specific you could speak to this, but in general, how reliable are these test results that we are providing? I know it's rapid turnaround with anything, with everything. There is the opportunity for human error and then scientific error, and then add into that the urgency and the round-the-clock working. So on average, I know that I don't know that you're gonna be able to answer this question, but maybe just from being in conversations with other members of your agency.
Yeah, and I can't get into the specifics of that because I'm not with disease control, but what I can tell you is there are a number of tests that are out there, and some are more reliable than others. And we've seen, like with the rapid ones, we've seen more false negatives than we have anything else. So if we ran those tests and, against like the swabs, we can see that those are creating more false negatives than anything else. So with different testing, there comes different results. And so they are doing that. I mean, the research going back and, testing multiple different times with different testing kits, then we kind of learn what is accurate and what is not accurate. I wouldn't be able to give on average, the exact amount of what would be considered, false positives or false negatives. But I do know that the state lab, when there is an error, whether it's machine error or human error, they are quickly correcting that and they will retest. So there's when you do like swabs, you have the ability to retest, to do a second test. And if there is any, a chance that we can't test it, we will get a hold of the individual and have them tested again. So the state lab is really doing a thorough job in making sure that we're getting the most accurate results out to the communities.
Wonderful, thank you. So this is a good school-related question. What happens when a school discovers a COVID case among its students or staff? What steps are taken? So the question actually is, what sort of steps are you planning to take? And actually that's more in the future, but we actually have had this experience. There are tests that are associated among students and staff. So what are the steps that are taken when that happens? And of course, I
Sure.
know there's probably two different routes to this plan.
There's many different routes to this because we have parents that know and they're contacting the schools, and then the schools are contacting the state or their local public health units. We also have parents that are receiving it like through the My Stanford charts, and it hasn't even gone into our system yet. So, but for an instance, we already have positive cases in our schools. And so what is happening when we identify that it is a K-12 affiliate through our investigation process, we are being notified at the state, and we are being then notifying local public health, or we're both being notified at the same time. And between the state health department and the local health departments, we're working in tandem. We are communicating constantly. So if we do have a case within the school, we obviously contact the parent and we remove the case. And so then we start the investigation process, and then our team at the state, and they're called the school COVID coordinators, and then also the local public health teams also can work with the schools. And so there's a point of contact within each school building, and we will work with them, and we will go through the school day, and we'll actually go back to their onset date and 48 hours prior and start walking people through what classes were these children in, were they any outside activities, and we'll start compiling school close contacts. Once we have that list compiled with the school, then we will help them. We have a letter template, and basically what happens is we will put, dear parent and guardian, your child was a close contact with positive COVID-19 case. We will provide them with the exact quarantine dates that the child would need to be in quarantine and out of school completely. And we are going to then auto-generate those out to all the school close contacts. With that being said, an investigation on the disease control side of things is still taking place. So the case, and then any social interactions, like did you go to grandma and grandpa's? Did you spend the night at your best friend's house? We're going to gather all that information, and those contacts will be continued to be monitored through the regular disease control investigation. But I just want to make clear that local public health and the state school COVID coordinators, our job is to compile the school close contacts, get those letters out as quickly as we can to the parents and guardians, so they can make sure that they can make arrangements for their student to be quarantined for that 14 days. And then of course, if it's a household contact, quarantine dates will look a little bit different. And so we'll work with the schools through that whole process, and with our disease investigators as well.
So I think this is going to go into a question that I think is maybe more school related, but it's an opportune time for me to share this. So you talked about a student that was a close contact or a case, a confirmed case. So if you're a confirmed case, 10 days. If you are a close contact as a student, 14 days. So with that being said, that means that student is then out of school for 10 days and 14 days. So the question that has come to us is, the governor and I had our schools allow the opportunity for every family that wants to continue distance learning, 100% distance learning, that they had that option. And some school districts have said, well, you needed to sign up by a different point, by a certain deadline. And so in the cases of quarantine and isolation, if that student is a close contact and cannot come to school, that distance learning option needs to be in place for that student at that time. And so I think when many of those school district policies were created, we were at a different time. And I think that there was maybe not as much understanding of how fluidly some of our students would need to roll in and out depending on their confirmed cases and close contacts within their school district. So I believe many of our school districts are reconsidering and reevaluating how they might want to have that distance learning option presented. And so in that case, if you are a family that has decided previously that, no, I feel really safe I feel completely safe. I'm going to have my child go into, the face-to-face 100%. Times change. Counties are going like this up and down as far as their 14-day average of cases. And so I think everyone is providing a little bit more, or understanding a little bit more how fluid and responsive that those decisions need to be for a school district. So if you are a family in that situation, I would have that conversation with your local school district. But do know that if your child is ever a close contact and is going to require quarantine or a case and require isolation, that distance learning option will be in place and must be in place for your child or your family member. So, is a person required to cooperate with a contact tracer?
My answer to this would be yes. We would recommend that you have communication with your contact tracer. That's how contact tracing works. If we don't do contact tracing the way it was designed to be done, then we are going to see the community transmissions rise, because we're just not abiding by the recommendations of the Department of Health. And so you can opt out, but we prefer that you don't opt out because of that. And to be a part of North Dakota and being, personally responsible for the well-being of our students, our staff, our communities, it is 100% recommended that you follow through with any guidance that your caseworker is providing to you, because we understand that it's not an easy thing to do, and nobody wants to be in quarantine for 14 days or 24 days or isolation for 10 days. We understand that, we sympathize, but it is really important to keep our communities safe. And again, I'll just say this because Superintendent Baesler and I have said this over and over in the meetings that we've been together. If we want to keep our children in the schools and safe in the schools and get the education that they deserve, then we as adults, we need to take that responsibility on and make sure that we are abiding by the North Dakota Department of Health recommendations. So my answer to that would be, yes, please follow the directions of the case investigator.
I would echo that. If we really want our children in school with their teachers that want to teach them face-to-face, we need to follow the processes that are set up and established. They were set up long before this pandemic hit, and they've worked for other issues, and they can help us now. So that leads us to an interesting question, asking for your opinion. Are you optimistic that our school doors will stay open?
I am optimistic because I believe that our, North Dakotans are smart. We are going to take responsibility, and we are going to give back to the children what was taken from them in the spring. And speaking as a parent of a student as well, I saw a lot of our graduates. I saw the proms. I saw all of those things that were missed by our students. And I know it was stated by Superintendent Baesler in her press briefing that, they sacrificed a lot. And so we as adults, we need to think about that and realize what it's going to take for our schools to stay open and continue to be open all year long. Are we going to have classroom closures? Are we going to have possible, school closures? That is always a possibility, but my optimistic self would say that we as North Dakotans are smart, and we need to really think about what our choices are and what is really important. And our children are our future, so those are the most important people in my eyes as an educator as well. So yeah, I'm optimistic that we can do this, and with partnership between the Department of Public Instruction, the Department of Health, and our local public healths, we're forging forward, and we plan to do everything possible to keep the school doors open.
Couldn't have said it better, Sarah. Excellent answer. Do the contact tracing apps that the governor talks about, do they do any good? Are they helpful?
Yeah, I mean, I believe that they are helpful. There's always going to be some tweaks and things that are going to be, updated, just like our phones. I mean, we get updated, we have to update our phones, right? And so apps have to be updated. These particular apps have to be updated from time to time as well. The 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 reason around this is really to be innovative and use our technology to the best of our ability. And sometimes when we are contact tracing and case managing, and I should say that I did that portion as well. I was in Cass County, Williams County, and Montreal County case managing and case tracing. And so I did get to see that side of the world too. And a lot of people don't remember all the time where they were. And that's, I mean, that happens to all of us. You know, you have to go back 48 hours. And so through the contact tracing, we'll say, okay, on Saturday, did you go out for breakfast? Oh, yeah, I went out for breakfast. Where did you go out for breakfast? And so just reminding people of those things. And these apps are just another tool to basically help you guys remember. And then hopefully, like in the future, using Bluetooth, and you can see if you're in the vicinity of people that are positive or that, I'm not sure of all the technology myself, but I do know that it's for the betterment of the contact tracing and how we can really pinpoint where there are um, clusters of events happening, and we can really hone in and go in and quarantine and isolate and get that situation under control. So I really do think that those are important. And I know that I'm just putting this as a caveat out there that a lot of people think that their personal information is being shared. And the governor has said numerous times that that is not happening. And so with trust in him and his team that's working on these apps, we know that your public information is not being shared. So please do download the apps.
So, and I think I had a presentation by Vern Dosh, who is in charge of the contact tracing for the Department of Health and leading that work. And so the Care 19 diary that came out early this spring, and now most recently the Care 19 alert, are two significantly different apps. And so the Care 19 diary, I think, is the one that you were talking about, jogs people memory and actually does use GPS. This Care 19 alert, I have a much better understanding after having had a conversation with Vern Dosh. It actually it doesn't track where you are, and it isn't even person to person. So there is no personally identifiable information. It simply alerts you to if your device was close to another device. And so I don't know about you, Sarah, but like when my kids were young, they all had cell phones, but all of the cell phones were under my name.
Yep.
The only thing that the alert does is like Bluetooth. When you are able to recognize, like when you want to airdrop something to somebody, it recognizes the devices that are close to you. Or if you want to connect to a computer, it recognizes devices, but it never keeps track of where that device was. It just recognizes if somebody had a device, or if there was a device close to you and that device owner or whoever had downloaded that had a confirmed case, it's going to let you know that your device was close to that. So if there ever is a breach, which there wouldn't be, it would simply say that Sarah Massey's telephone number of 220XY, digit was close to another device. And so that was a completely different game changer for me, that it wasn't about a child or another individual. It was just about, two devices. One of those devices owner has confirmed positive case. So that was interesting to me and helped me better understand what that alert does. So when we say close contact in a school and we refer to the 15 minutes, is that for the whole day? In other words, could it be 55 minutes in the morning, 5 minutes at noon, 5 minutes in the afternoon? Could it be 15 minutes over the course of a week? What does that mean, close contact for 15 minutes or more?
It's a great question. And a lot of people are struggling with this question. And so what the Department of Health is saying, instead of cumulative and consecutive, we're using the word total for a day. So if your child is in contact, or in the distance between less than 6 feet or less for more than a total of 15 minutes throughout a period of 24 hours, they would be considered a close contact. So that means if your child was with Johnny here for 5 minutes, and then he wasn't, he went on the playground, and then, oh, they went to music class, there was 5 minutes here. These are all wrapping up to a total of 15 minutes. So when we are working with the schools, we're really looking at, you know, is it a total of 15 minutes? And the distance is very important to remember too. And so I know a lot of teachers are designing their rooms so they can have social distancing within pods and keeping kids within those pods, so we don't have that a total of 15 minutes, you know, for each of these close contacts. So if we can keep them away 6 feet as much as we can for less than 15 minutes a day, they're not considered close contacts. It's a total of 15 minutes for 24 hours.
Perfect. Thank you. I appreciate that. So these two are related. Two questions. How are my children's privacy rights being protected? Then a follow-up. Don't I have the right to know the identity of someone in my child's school who has COVID? So it's the same question on opposite sides, opposite perspectives. How am I going to know that my child's privacy rights, their health information is being protected? And then on the other side, don't I have a right to know if someone in my child's school has COVID? So
yeah, those are great questions. And so just so everybody knows that we have with the Department of Health sent out non-disclosure agreements between the Department of Health and every school district. And so with this non-disclosure agreement, this is basically telling the school districts that anybody that the Department of Health or the local public health units communicate with, they have signed this non-disclosure agreement, which will protect your students' private medical information. So we call it PHI. And so it's really important that you know that when we are discussing anything about our students or even our staff, that it's what they need to know. You know, it's not what they want to know, it's what they need to know in order to protect the school community as a whole. And so those are out, and those will be back to us by Friday. And until then, we are still working our investigations just like we would since March. The disease control investigations continue, and our schools are being notified of close contact and positive cases because it's for the welfare of a public crisis. I mean, we have to know so we can protect those in the school community so it doesn't spread. So in HIPAA, and then also with our disease control layer and Sentry code, we are working to protect everybody's public health information. And so you can be rest assured that those people that are working within the school districts and working with the state and local level health professionals, we will only be giving that information on a need to know basis. And as much information, I should say as little as information that we need to give is going to be given out. On the other side of things, should you know about a person that is a positive case in the school, we also have a letter template that is going to be going out, and schools can choose to use it or they don't have to use it, and it's a not close contact. So if you receive a letter that says there was a positive case in the school, but your child was not a close contact, you will know that there is a positive case in the school. You would not be able to identify the actual individual. That would be impeding on their rights. And that's something that we just can't give out. And so I just want to make that clear that, you know, individual names will not be given out to other parents or shared amongst faculty or anything like that. The only people that will receive that information are those that sign the non-disclosure agreements. And then of course, at the Department of Health and local public health, we're under HIPAA. And so we follow that. We're under confidentiality. We know what to give and what not to give out. And so everybody will be protected. But I understand the other concern as well. But
I also
you'll know that there's a case in the school. You just won't be able to, we won't give any identifiable information out that would breach that person's private health records.
And so from the other side of that, so the employees, the school superintendent that will be signing the non-disclosure agreement, essentially what that says is by receiving as little information from the health department as is necessary for that superintendent to do their job to help in the, to contain them and mitigate the spread and contain the spread. They are bound then by saying, I know by signing this that I am only going to inform the people that absolutely must know in order to help and assist in this public health crisis or this public health pandemic that we're experiencing. And you mentioned that they have HIPAA. So HIPAA is a federal law. It's very important for people to understand, and I don't think that many people in North Dakota, because we've never had a pandemic before, very few people in North Dakota know that we have, our state legislature has added in an extra layer of protection by passing a state law that is the infectious disease section of our North Dakota law book, our North Dakota Century Code, that goes above and beyond HIPAA and has an extra extenuating consequences and actually more punitive consequences if that is violated in the state of North Dakota. And so that's why that non-disclosure agreement is going out to our school employees and anyone within a school district that the local school superintendent deems necessary will also be needing to sign that disclosure agreement. So they cannot, and it's, I think, a Class C felony if they share information with anyone else that is beyond the people in the school district that have signed those non-disclosures and been identified as people that are necessary. So I think that's really important because people's private health is very, it's very critical
Very
that
important.
we protect that. Very, very important. And so then on the other side, don't I have the right to know if someone, who, the identity? Yes, you have the right to know if there is a case, but you don't have the right to know the identity. And when I'm asked that question, and I was often asked that question in my former life as in the public school system, don't I have the right to know? I ask, what if that were your child? And so, and we'll go back to, a lot of people laugh when I say this and bring this example up, but it wasn't a global pandemic that we were dealing with, it was head lice. And so kids can be cruel, and parents really felt that it was their right to know which child or children in our school community had head lice. And and kids can be cruel. Let's just say that. What if it were your child? Would you want every other family in this community to know that your child had this health condition? And so head lice is one thing. There could be lots and lots of diseases, but no, if it were my child, I wouldn't want every other family to know. So think about it that way, and maybe sometimes it's a little easier to understand. So, do we at the school have the right to take everyone's temperatures every day before we let them into the building? I understand that they do this at the Capitol. They do this at the Capitol. And so I, as an employee, have the opportunity to either be employed by the state of North Dakota or not. And so as part of that employment contract, I walk in, to get to my place of employment, I have my temperature checked. And so at this point in time, I don't, from what I have understood, and we don't have a state law that covers whether or not we can. And I think that there's some really good information that came out from the National School Boards Association today, available on their website. It says, may a school district require temperature checks of students? And their answer is, you should look to your state to see if there is. And at this point, there isn't anything in our state. And it says simply, courts have not addressed whether temperature checks for students and staff constitute searches under the Fourth Amendment's prohibition against unreasonable searches and seizures. So there's lots of court cases that may or may not be a result of this pandemic. There are lots of, that's the way our judicial system works. People have two different sets of opinion on this, and it rises through our judicial system, and eventually the Supreme Court makes a decision, and then case law is present for future cases. But at this point, our courts have not determined that. So temperature checks, I know, are controversial. some families don't want their child's temperature taken every day when they come in. So again, the courts haven't yet decided it. So that's, if you know anything more about that.
And I can just, yeah, I can add a little bit. I know that when the CDC, this was like now a few months ago, that they were talking about taking temperature checks and symptom checks before any staff or student come into their facility. And so, um, like I had talked about before, that we're not talking about, mass testing anymore. And what CDC really came down to is like, they don't recommend temperature checks or symptom checks when they come into the school building. Um, this can come down to local control as well and what school boards decide they want to do. But what we found is, or what CDC is recommending, is to put this back onto personal responsibility and asking the parents and guardians to be sure that, if their child isn't feeling good, if they have symptoms out there, and there's decision trees for parents on our websites that you can go to, and kind of it'll walk you through like what symptoms you should be looking for, temperature, the exact temperature it would be at, and then like cough, sore throat, stuffy nose. We know that those are going to be common cold things happening, and so we don't want to just say, oh, it's COVID related, but we have the decision-making tree out there for both parents and for schools to determine if a student should be tested or not. And then there's also guidance about if you don't test your student, that you should just stay out the 10 days if you're not going to be tested. But going back to that personal responsibility and CDC asking them, parents check for temperatures before your kids leave, check for symptoms. That way schools don't have to do that and impede on anybody's rights there either. Another thing, just as an educator, I can about imagine when and I just take my daughter's school as an example. You have Legacy High School with close to 1,800 students that go there. Where are they going to go, and how they're going to be in a congregate setting for a long period of time as they walk in and get checked for their temperature or symptoms every single day. And so we're taking time out of the learning day and not giving them the education that they need. We only have so many hours in a day to educate our students, and by doing this, it's eliminating a lot of time out of the school day. And so that's my mind kind of thinking about why CDC went towards it, and then also the impeding on people's rights.
And, in visiting with superintendents and school board leaders, at first I think that they thought, well, that's a good idea. But as they began to measure the cost of the device or devices that may be necessary for multiple entrances and the return on investment on that cost, so they didn't feel that there was really that great return on investment, and then really kind of a false sense of security, because so many of these students can be asymptomatic anyway. So in totality, it might be an extra thing to do, but I've just heard that there's lots of other ways to maybe mitigate the spread or the transmission that are going to cost far less and have a greater return on investment, and in addition, not provide that false sense of security. So
yeah, absolutely.
I think that's in some conversations with some of our leaders in the state. That's just what they thought. They considered it, but it just wasn't. It wasn't a very wise decision in the end. So, so this you've answered the first part of this question. Once a staff member or student tests positive, how long do they have to be away from school? You've covered that. But the second part: are they required to be tested before they can return?
As far as I know, they do not need to be. And again, this can be, so for an example, we dealt with businesses all summer and talking about, if staff return after being positive or being a close contact, they needed to have 2 negatives before they were returning to work. And so because they're private entities, they can go ahead and mandate that. And superintendent, you can correct me if I'm wrong, I have not heard of any school districts that are requiring that. And so it's not recommended that we do that at this point in time. But again, I always want to say, when we're dealing with COVID, that today we're not recommending that, but things we all know change in a day or in minutes sometimes, and we have to be ready for those changes as well. But as from my knowledge, that no districts are requiring that.
And none to my either. I have not heard of a district that is requiring it. So this, they're not, these are tough questions. There's another tough one coming up. And so they're not going easy on you tonight, but I do appreciate so much time that you're giving to us. Can the local health order our schools to take steps to control the spread of COVID-19? Who has the final authority? Local public health or local school board?
Great question. So what local public health and what the state Department of Health are going to be doing when we are talking to you about cases that you're having in your schools, and if you're a hot spot potentially, we have a mitigation flow chart strategy that we have in our guidance that both the school district superintendents have seen and that our local public health. This is a tool for them designed to basically calculate the number of cases per your county, and there's a whole equation out there that they're going to be calculating on an everyday basis. And so with that information, the school board and the school superintendent, along with the local public health, they can sit down and really decide precautionary measures, if there needs to be something more put into place, if we need to close classrooms, if we need to close buildings, if we need to close a whole district. Hopefully we never have to see that. So those tools are out there for the use of our districts and our local public health units. Now you also have to understand that we have, medical, at the local public health, we have those officers that are there for every region. And so they do have the authority to come in and override everything. So if they feel that there are not being the necessary steps to protect our staff and students, they have the authority to come in and shut down a school.
And I think that's pretty important. So again, so to maybe sum that up, said just a little bit differently, but same thing. Sarah and I really do that a lot. We're saying exactly the same thing, and we're just saying it differently. And
different way.
A while to, it's like, I think you just, yeah, we agree. So, so I am trying to affirm what Sarah said. So, so in the Return to Healthy School Plan in the governor's executive order, it stated clearly the health and safety plan would be developed in collaboration and consultation with the local public health units and approved by the local school board. So ultimately the school board needed to approve what the plan was, and they had the final say and the yay nay vote of it. It was required that occur with local public health and the local public health units, districts, departments within each of our communities. So there was a requirement that it was done with that. But at the end of the day, the vote of authority was the school board. But saying that, our North Dakota Century Code does allow in order to protect public health, that the public health board administrator officer of our local public health areas does have the authority. There are some significant litmus tests, if you will. There are some very specific conditions of imminent, whether it be imminent, I don't think that's the specific word, but it has to be, that the school district is not being reasonable, and there could be negligence, and there is this danger of threatening public health. And so again, it can't be in our as we've looked through Century Code, attorneys have gone through, and there's Century Code that gives authority here, weighted authority for a school district, and then another area of Century Code gives weighted authority to the local public health. And I believe that was quite intentional. We've surmised that was quite intentional, that it wasn't going to give one side or the other overwhelming authority to make these decisions. It was intended to force or not, do more than encourage. It was intended to require that school districts and public health districts work together to find these resolutions. And so there isn't a clear-cut answer on that, but I would say it's not an either or, it is a both and. So, and our North Dakota Century Code has been very deliberate about braiding those two entities together to make these decisions together. So So one final question for you tonight. You have just been a trooper with us. It has to do with outdoor activities. And so, you know, lots of students returning to school, they're outside playing, recess, lining up outdoors. Um, are there any restrictions or guidance on social distancing outdoors? And how should schools and teachers go about that when their students are outdoors?
That's a great question. And, you know, I have talked to a lot of educators. I'm still connected in the education world. And so they know that I'm a part of the Department of Health team. And so they ask a lot of questions. And so being outside is optimal. I mean, we know that because it's fresh air and kids can stay 6 feet or more away from each other. We know when they go out for recess, you know, that they are going to intermingle. They're going to be in less than 6 feet with each other. My hope is that, like if we just take elementary as an example, because they're the ones that have recess. So if the teachers are having their students in cohorts or in pods, my hope is that they would also be deliberate in making sure that those cohorts or those pods stay together during recess times. So there might be more recess times, not like the minutes, you know, that a kid would get more, but it would just be more frequent that other groups would be going out to make sure that we're keeping these cohorts or pods separately. And then when lining up, I know that a lot of schools are marking their sidewalks, they're marking their hallways. They're really trying to take the preventative measures to keep that social distancing to occur. But we do know as parents and we know as educators that when we have a first grade classroom, that they're not going to just stand still on an X. And so we just really are encouraging our educators and our administrators to number one, practice what you preach. So don't be in the hallways and chit-chatting away. We want to make sure that we practice what we preach. If your schools have that mask mandate, that our staff is also abiding by that as well. But outside is going to be the most optimal, right? Because we have the fresh air, we have a lot of space. So I anticipate a lot of classrooms going outside while they can. Of course, we have the inclement weather that we have in North Dakota that eliminates some of that from time to time. But even, you know, having lunch outside, going outside and, you know, doing a picnic, but maintaining that social distancing. But then we also just have to remember that our kids they're inquisitive. They want to be by their friends. They want to talk. And that's just not elementary. I was talking to my daughter, at the high school level, and I said, you know, how many high school kids can keep their hands off of each other for like 15 minutes? And I just mean like high-fiving or, you know, around the neck and all those kinds of different things. And so the more that we can educate our kids about keeping the social distancing, wearing those masks when we can't maintain that social distance, and being outside as much as possible. I've heard educators, you know, science class outside, absolutely. And PE classes outside, absolutely. And so there's just many different ways that you can go about this by keeping social distancing. And then I'm just going to say too, like I've seen a lot of classrooms that have been designed. I have a friend that's a kindergarten teacher and she's using yoga mats and she's got trays down. And so we're keeping the distance with the yoga mats, and then they each have a tray, a learning tray. And so she's trying it. Yeah. And when I looked at her classroom, I was like, wow, you know, you really thought through this and really creative. And people, you know, are getting those ideas off of Facebook and Pinterest and all those fun things. But to answer the question outside, I do know that schools are taking those precautionary measures and marking, you know, with spray paint, tape, or however they want to do it, to keep those kids separated when they line up, and then keeping them in cohorts as they go out for recess and things like that. And the eating environment, you know, eating within your cohorts. They might not be going to the cafeteria. Their lunch might be coming to them. But yeah, getting the kids outside as much as possible is very much encouraged.
Those are great suggestions, Sarah. Thank you so much. So to close this out, I'm just going to, one of the questions that has come in, just talking about the press conference. and asking you and I to remind staff and faculty, and you've done it frequently more than once during this conversation with you tonight, that they need to be following the guidelines that their districts have put out, walking the talk, practicing what we preach. There is just no way other than everybody taking personal responsibility that we're going to be able to keep our kids in school. And you are optimistic, I'm optimistic. You talked about the creative ideas that people are sharing. We're smart. We're going to problem solve our way through this. We have great pioneer heritage ancestors that have conquered many, many elements in North Dakota. And we are from that stock of we have hard, challenging situations, and we figure out how to get through them. And so I too am very optimistic. I just want to thank you again for spending this entire hour sharing so much information, answering some tough questions, and providing some really valuable information. I think you've shown our viewers and those that have joined us tonight how lucky we are, how fortunate we are to have Sarah Massey as part of this team. Your wealth and breadth and depth of knowledge is truly apparent, and we are very, very fortunate to have you helping us solve and problem solve our way through these situations that no one ever saw coming and we've never seen before. But we'll with your help, with the partnership and working as one with government, we will find our way through this, and our students will be able to have that dual mission of high quality education while keeping their families and communities safe. So thank you so much for joining us, Sarah. Take care and be well.
Thank you.